Dr. Jess here. If you're an athlete that's subject to drug testing, whether that be by USADA, WADA, or your governing body of whatever sport you're participating in, or simply someone who trains regularly, it's important to realize that some substances, including common medications, supplements, may present a risk for testing positive for a banned substance or a potential health risk for you as an athlete. Here are some substances that athletes, parents, coaches, and healthcare providers that are working with athletes may be surprised that pose a risk for anti-doping or a health risk. The first medication is going to be your ADHD medications. These are like your Adderalls, Vyvanses, Ritalins. While 11% of students have a diagnosis of ADHD, this medication is actually banned in competition since it offers an actual or potential mental performance enhancing benefit to the athlete. And it provides improved attention and focus in virtually every sport. If you're someone who does need this for a medical reason, you can submit to get a therapeutic use exemption, but you do have to have proper documentation. Another concern with these medications is the side effect that a lot of people experience is appetite suppression. This is a common side effect, and while many athletes, especially our young ones, tend to underfuel, these medications can actually enhance that or lead to unintended weight loss. Another medication you may be surprised to find is going to be spironolactone. This medication is often prescribed to some women for severe acne, PCOS, or other gynecological reasons. And for some people, it also may be used in high blood pressure, but this is pretty uncommon in youth or athletes, but it is possible. And this is prohibited because it acts as a diuretic and it can function as a masking agent to hide the use of other performance-enhancing medications. Another banned substance that this one is really interesting is going to be IV therapy or your hydration lounges. While there's a lot of hype over IV therapy, drip lounges for their immune boosting, recovery therapies, this one often gets overlooked by athletes. Due to the risk of using IV therapy to dilute blood samples, an IV injection over 100 milliliters a day requires a therapeutic exemption. While there is an exception for cases of emergency, such as having like an athlete who is vomiting and has severe hydration that ends up in the ER. The patient athlete safety comes first, and the athlete should receive the IV therapy if it's warranted by medical providers, and then notify their governing body or the appropriate organization as soon as the emergency is resolved regarding what occurred. Pseudoephedrine, or the common over-the-counter Sudafed, which is used as like a nasal decongestant for most people, is a banned substance on WADA's list because it acts as a stimulant. It is similar in structure to ephedrine, and it works in your central nervous system, and it is believed to have some ergogenic effects. So this one is also banned. So if you have a head cold or you have an athlete asking for how to get through competition because they have a head cold, you may want to steer clear of the Sudafed because this can test positive as a banned substance. Caffeine. This one I get lots of questions about, especially regarding energy drinks. Even though it may sound familiar and benign, caffeine can come with a lot of health risk and actually even some anti-doping risk. In regards to anti-doping, we'll make this one simple. Caffeine is permitted in sport according to WADA and USADA, but if you're an NCAA athlete, you do have limited amount of caffeine that you can have in your blood. While it is a little bit high, it is still not unreasonable for having an athlete consume that much caffeine. This is based because of the American Pediatric Society, because they do not recognize any level as safe for youth or adolescents athletes. But also, energy drinks can pose their own risk because they may contain banned substances or substances that have not been studied in the body to know how it may affect your performance. Two of the last ones are going to be inhalers. Just because a doctor prescribes an inhaler doesn't mean it's safe to use under anti-doping. It's a good rule of thumb for medications to be checked under global DRO and also with your governing body. There are some differences between like WADA and NCAA or NFL. Different governing bodies have slightly different rules, so you definitely want to check with them. But inhalers, depending on the type of inhaler or the amount you're using, you may need a therapeutic use exemption. And the last thing I want to discuss is supplements. Supplements can pose their own risk because they can be contaminated. Supplements are not regulated by the FDA, therefore they can contain anything in that product and it may not be on the label. So it is your responsibility as the athlete to determine the safe supplements to use. And I usually go with NSF certified products or those that are informed choice so that you can guarantee supplement safety. I hope this helped give you a little bit more information about some commonly found medications and over-the-counters that may affect your performance and or your safety. The specifics of in and out of competition or even those banned for your governing body, such as NCAA, again, may differ from USADA or WADA. So you do have to do your own research and ask questions of your healthcare provider by bringing in the list and asking, are these banned? What do we need to do in order to get them improved? So if you have any questions, drop them below. And I hope this gives you a little more insight into anti-doping in sport and clean sport.